Well, we've all seen the numbers. The Omicron variant exploded over the Christmas holiday, with states across the country shattering new records. This as the CDC released new guidelines which shortens quarantine time. Our Lindsay Buckingham went to a local expert to break it all down.
Yesterday, the CDC cut isolation times for asymptomatic Americans with COVID-19 based on evidence that infected people are most contagious in the 2 days before and 3 days after symptoms start. But the new information has some people confused on when it's safe to leave the house. We spoke to Dr. Kristin Englund, infectious disease physician at Cleveland Clinic, to help explain. First question, if you test positive, how long do you isolate?
If you test positive and you're asymptomatic, or if your symptoms are improving, at 5 days, you can come out of isolation.
And after isolation, the CDC says you have to wear a mask for another 5 days in all settings. But if you have a fever, that changes things.
They don't want you to come out of isolation until your fever is completely gone.
Now, here's where you should pay attention. If you've been exposed to COVID-19 but have been boosted or had the 2 initial Pfizer or Moderna vaccines in the last 6 months, or the Johnson & Johnson vaccine in the last 2 months, you don't have to quarantine if asymptomatic. But you do have to wear a mask around others for 10 days. The guidelines are different for the unvaccinated.
If you're unvaccinated and you've been exposed, then you should isolate for 5 days, get tested, and at the end of that, if negative, then you can go back out into public, but you should be wearing a mask for another 5 days.
Now, in addition to those rising COVID case numbers, there's another crisis, and that is the overwhelmed hospital systems. That's why Dr. Englund says you should know when to go. And unlike COVID-19 tests, these pulse oximeters, which go on your finger, are readily available at pharmacies. So if they read in the low 90s or you're feeling shortness of breath, you should go to the ER. Lindsay Buckingham, 3 News.